First tonight, there are fresh warnings about alcohol consumption in our region. The drugs and alcohol charity NORCAS claims that there's a growing trend of problem drinking, affecting an estimated 120,000 people in Norfolk alone.
Now, the figures are startling. 1 in 5 adults drink more than is healthy for them, while 1 in 7 adults binge drink. Malcolm Robertson has been speaking with drinkers and the charities set up to support them.
Richards has been an alcoholic for 20 years. It's been a sad and lonely journey, one that's cost him his marriage. It got to the stage where drink was his only friend, and he would down a lot of it. John, who lives in Great Yarmouth, is one of an estimated 25,000 people in Norfolk alone with moderate to severe alcohol dependence. But he got in touch with NORCAS, an East Anglian charity that works with those who have alcohol, drug and gambling problems. Today he told me how he turned his life around and has gone 71 days without a drink.
A day would consist of waking up on the kitchen floor with an empty whiskey bottle beside me, getting dressed, going to a shop and getting another bottle to drink, day after day.
On the day that NORCAS relaunched to raise its profile, some worrying statistics emerged relating to those with alcohol problems in our region. Almost 20% of people in the east of England are problem drinkers, which for men means consuming between 22 and 50 units of alcohol a week and between 15 and 35 for women. Cambridge has one of the highest figures, with more than 22% drinking too much. Norwich and South Northamptonshire are also above 20%.
The figures overall for the eastern region are slightly below the UK average. But that's nothing to be complacent about, because it's still a relatively high number of people that have real issues. And for every one person that has a real problem, it will affect all those people around them. So you could multiply that by 5 to actually understand the numbers of people that are really affected by the problems caused by alcohol.
Among those addressing today's meeting in Norwich was Stephen Lanham from Lowestoft. He had to give up a good job in a hospital laboratory because of his heavy drinking. He's now stopped and is working as a volunteer for NORCAS. He told me how dismal his life had been, drinking beer, vodka and as much as 6 litres of cider a day, and then relapses along the way.
I know what it can do to your mental health. I mean, it absolutely destroys you. That was, for me, the mental health was the worst factor, although physically I was very ill as well.
John Richards also knows all about that. He still regards himself as an alcoholic, but the 10 weeks that have passed since a drink he regards as a real triumph.
At the end of each day, when I put the mark it off on the calendar, I think, well done, you can do it.
Just being able to enjoy the simple things in life mean a great deal to him. He still attends Alcoholics Anonymous twice a week, hoping he can provide an inspiration to others stuck in a very dark place. Malcolm Robertson, Anglia News.
Well, the Institute of Alcohol Studies, based at St Ives in Cambridgeshire, provides independent information about drinking. Earlier, I spoke to the research manager, Dr. Rachel Seagrove, and asked whether 100,000 people in a county the size of Suffolk or Norfolk having a problem with alcohol was a figure she recognised.
Yes, certainly. The whole country has a problem with alcohol, and we've seen very long-term trends of year-on-year increases in the amount people are drinking. And there's a close relationship between the average amount that everybody drinks and people who have problems with alcohol one way or another. So the more everybody drinks on average, the more people are going to slip over the edge into one kind of problem or another with their drinking.
So what would you regard as problem drinking? How much can we drink?
The government guidelines on drinking are 2 to 3 units a day for women and 3 to 4 units a day for men. 3 units is a large glass of wine or a pint of strong beer. So it's a sort of one drink a day sort of level.
So what's the advice then for us as individuals and for society in general?
Well, as individuals, the first thing we can do is be aware of how much we're drinking and try and keep track of those units relative to the government guidelines, because very often we're drinking more than we think we are. So just being aware can help. But as a society, well, we're talking about the government really, and the tools that are available to the government, although unpopular, the effective tools are price and availability. Alcohol is just too easy to get hold of and too cheap. Whereas if it's a bit more expensive, a bit harder to get to, people will think twice about drinking as much as they are doing.
Dr. Seabrook, thank you very much indeed.